Hey guys, it's Jennifer. I'm just making this video because I promised that I would make a video once I started the whole plastic surgery adventure. And I started it today, which is January 14th, 2014. And I'm going to try to keep this video as brief and to the point as I can, but I ramble, and you know this if you've watched any of my videos. Excuse the appearance, it has been a crazy long day today, and it's only Tuesday, and it's been a crazy long week, and it's not going to calm down anytime soon. So, excuse the appearance, I look like crap. Alright, so I made a consult with a plastic surgeon who is just a private plastic surgeon office. I had my bariatric surgery with Barrix Clinics, which is B-A-R-I-X. They only specialize in bariatric surgery, and they offer the skin removal surgery as well, plastic surgery. But in order to have a consult there, it was $100, and I just have never had $100 to go. Where I had my consult today, they bill my insurance, and then whatever is left over, they bill me. Which kind of sounds kind of asinine, I guess, because I'm most likely going to pay a lot more than $100. But when you're billed, it's easier to make payments than just coming up with $100. So anyway, so I went to my consult. This plastic surgeon's office is in a very affluent neighborhood. So I was kind of uncomfortable even going there, and I got lost on the way there. And then when I got in there, the only other person in the waiting room was this absolutely gorgeous Mediterranean woman who was easily a size 0 and kept looking at me in this disgusted look. And she very apparently had paid for a few of the doctor's vacations because she had a lot of work done, and you could tell. But she kind of made me feel uncomfortable, but I kept having to remind myself, like, I deserve to be here too. So once I got back into the room, like the financial manager, whatever, she came back, went over my paperwork with me because I had filled it out all online, let me watch a video about body contouring for people who have lost mass amounts of weight. And then after she talked to me, the physician's assistant came in, and she kind of explained, she explained and she did diagrams of all the different procedures that I would be considered for, and not just because I would be considered for it, but anybody who's had major weight loss, that they would be considered for it. And she explained to me how the procedure was done, you know, exactly the details of it all, where cuts were made, where scars were made, how the procedure actually happened, like where she folded the skin, how she pulled the skin down, how far into your body she actually goes, where the healing process takes place. I mean, she was very thorough. So that was very, very helpful. And she answered every single question I had. Once I was done talking to her, then Dr. Ellen, which is the plastic surgeon, came in, and I felt completely comfortable with everybody that came in that room and talked to me, even though it is very unnerving to stand in front of somebody completely naked and have them pinching and grabbing and telling you where you could get rid of stuff. But it was also very liberating because it was good to hear. The only thing that she really confirmed was that I do have a lot of excess skin in my arms. And she automatically told me, like, that's not an issue to get rid of. That's easy. And that I would have good results. So I felt much better with that because that was my main area of concern. I did not mention what surgeries I was considering. I wanted her to tell me what she thought. So most of you know that tummy tuck is covered with insurance under certain circumstances. She gave me a quote for if I just wanted a tummy tuck done. But with the way that my body is shaped and the way the excess skin and still some of the fat is located, she recommended that I get a 360 body lift, which if you've never looked up a 360 body lift, it is quite gruesome and amazing that they can do that to a human body and the people still live and wake up afterwards. But It gets rid of all the stomach. It gets rid of the sides. It gets rid of the back. It does a lift on the outer thighs, and that's all one procedure. So she would do the 360 body lift and my arms as one surgery, and then within 12 weeks, as early as 12 weeks, I could go back and get my breast lift done. And when I do my breast lift, I'm getting the breast lift, and then they're taking my own tissue, which is like kind of on the side. I'm sure a lot of the women have this, like you have this like extra pocket of skin on the side, and they're going to take that and push it forward and make my boobs full. So I don't want to have implants. I wanted everything to be as natural as possible. I know plastic surgery isn't completely natural, but when you have excess skin and you've lost this much weight, I've lost 113 pounds, so it's just time to get it done. I was shocked by the prices, and I'll just kind of go over that real quick. Let's see, for the 360 body lift and the brachioplasty, which is the arm lift, the total was $9,800, so 980, well, actually 9858, which I thought was extremely reasonable because that covers the surgery, the surgeon's fees, the anesthesia, and the hospital stay, and you're in the hospital for 1 day. It also includes all the drainage tubes and everything. And with the 360, with tummy tucks or the 360, there's an additional surgery that they can do while you're under, that is muscle tightening. And it's really, that's what it is. It tightens the muscles underneath where you're having the surgery. That is extremely painful, but when you do that, it gives you better appearance. It gives you a better appearance. When she was touching around and stuff, she said that my muscles were fine. My muscles were good. But she still wants to do the muscle tightening because it would have a better appearance. So she included that in this price. So $9,800 for that, for the one surgery. And then when I do, it's called a breast auto augmentation because it's your own tissue. That is $5,600. So really, when I added it all together, what was the price? When I added it all together, it comes to $15,489. That does not include the inner thigh lift. The inner thigh lift would be $6,000, which is insane. But it's a very delicate surgery because the skin there is much more delicate. And she doesn't even want me to really consider that right now because once they do the 360 body lift, and once that kind of settles, your thighs already look different because they're the skin being lifted. So it mostly helps with the outer thigh area. But if at the time, she said, if at the time that I'm done healing is 6, 9, 12 months out, she said, once you can actually visibly see your inner thigh all the time, if it's still really bothering you, you can come back and do the thigh lift. The 360 body lift and the arm lift is a 6-week healing period. I would go back to work within 2 to 3 weeks. And like I said, you have to wait at least 12 weeks before you have any other surgery. The breast lift and auto augmentation is an outpatient surgery, which I think is insane. And even with the 360 body lift and the 360 body lift and the arm lift, I'm only in the hospital for a day. She said the first 2 weeks are the worst, and that I will absolutely lose weight right afterwards, because not just because of the skin that's being removed, but because you feel so absolutely horrible that you are nauseous and don't feel like eating, and it's just terrible. I mean, she flat out told me that, like, you're going to be miserable for 2 weeks. After the 2 weeks, you feel a lot better. So I'm glad that she was at least honest about that. So I'm going to flip this around and just kind of, I can actually see my medical charts and everything that she did today online when I sign in. So I'm going to kind of show you a picture of somebody who has a very similar body shape and issues, like the same issues that I have. So you can kind of see the before and the after, because I'm not putting my naked body anywhere on the internet. So I will show you somebody else's naked body who didn't mind posting their pictures online. So let me turn this around, and I'm going to have to hope that you can see it, because I can't really see both of these at the same time. Let me see. Okay. Dang, YouTube's on YouTube. Okay. So that is the before and the after. And that's kind of basically my body. I mean, that really does look like my body. Dang, I wish I could, like, see this at the same time. Okay, let me try this. So that's really what my body looks like. I mean, that's almost me to a T. And then the picture next to it, obviously, it's the after. And if I look anything like that, I will be so freaking happy. It would be insane. Like, I would just be floored. I'd be so happy. I hope that came through. And if it didn't, I apologize because I'm not very technically advanced. So after going through all this, I am very, 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 very excited. I'm going to apply for the financing today through a company called United Medical Credit. There's United Medical Credit and there's Care Credit. Care Credit is pretty tight with, I mean, they're pretty strict with their, who they give credit to. Apparently United Medical, what did I say? United Medical Credit is a little more lenient. They do accept some bankruptcy cases. Both of those companies, you can get a cosigner. So I'm going to try for financing for the 2 surgeries so I get everything done. If they get approved, then I have to wait till at least April to do anything because of my work schedule and my school schedule. But it's crazy that I could have a surgery in April and then 3 months later, which would be like May, June, July, and then like July, have my breast lift done, which means that I would be going to Atlantic City as a woman who actually liked her body, and that's crazy to me. That'd be crazy to celebrate my 35th birthday, which is in September, with a body that I liked, and going to Texas finally, which I've been wanting to go to for like 8 years. It would just be a crazy, crazy year. So this is now my goal. My first goal this year is to get to Texas on my birthday, like I've wanted to do for a long, long time. But my second goal is getting this plastic surgery done. So there you go. I will find a way to do this, even if I have to get another job, but it's really going to be crazy. I got to figure something out. So that's my plastic surgery. That's where I'm at right now. This week, I don't even know how far out I am. I know that I'm like 22 months out. And I was 210 today, which I've been in the same weight range for a year. So, that was one of the qualifications that they needed for plastic surgery, was you have to be stable with your weight. They want you near your goal weight, and that's just not going to happen for me. But she was okay with me losing over 100 pounds and being stable in my weight for a year. So that was that. The next is just trying to get the financing, and if I can't get the financing, then I'm just going to start saving as much as I can from my financial aid refunds, and I'm getting the stuff done. Even if I have to wait till the end of the year, it's getting done. I'm so excited now, and I finally feel like I might actually be able to enjoy the success that I've had with surgery, even though I have not been as successful as others. I can only focus on my journey and where I am and where I've been. So I'm really looking forward to hopefully having a body that I feel comfortable and confident in, because I've never had that in my whole life. And I think everybody deserves that. So it's my goal. Thank you so much for watching, and I'm sorry it's such a long video, but I hope it's been somewhat informative. If you guys have any other questions, leave them in the comments. I'm going to post this on YouTube and on Facebook. And I just want to thank BSG Tanya for being so supportive, and I asked her some questions yesterday about what to ask, and it really did help. Her information helped me to know what to ask today. And then just Jen Johnson and Michael and Tony, these people are kind of my staple people that I talk to every single day. I don't talk to Jennifer every day, but every time I talk to her, I feel like I've known her my entire life. So I love all my friends, and we all have certain connections. But those 3 people, actually I said 4 people, but those 4 people are important to me, even though I don't really talk to BSG Tanya very much. She's really inspirational to me, and I think she's just the sweetest person ever. But anyway, thank you to everybody, because you really make a difference in my life. So I'm going to go, and I will talk to you guys all soon. Thank you so much for watching. Again, questions can go below, and I will update again as soon as I can. Bye.